Nice and relaxed. We're here today with Kathy.
Hi.
And we have been treating Kathy for a few years now, for 5 years I think. She first came in with neck pain, lateral disc bulge where she had numbness tingling down into her right arm. We've been keeping that calm for most of the time here. We're more on a maintenance schedule, so you come in as needed, you get your tune-ups, some traction now and then, and we get you feeling good so you can keep doing the things you love to do. So a little joint play in her mid-thoracic. A lot of times when we have upper segmental somatic dysfunction up in here, it kind of follows down to the other segments of the spine, particularly in her CT junction where the neck meets the mid-back, and then down here where the mid-back meets the low back essentially. So those two areas are the main areas that people hold tension. So right here, you're gonna lift your chin up, so keep it rested on that table. Perfect. Big breath in. Easy exhale, let your whole body sink to that table. Good job.
Oh, that was good.
Beautiful. And then chin back down. Yep. Nice. So you're a little restricted in that CT that I mentioned to this way. So if you want to rotate your head to your right. Perfect. Gonna take this slack out. You're gonna feel a little pressure here and here. Good job. And then rotate the other way, please. And another big breath. Easy exhale. Pressure. Good job. And then now, beforehand we already looked at Kathy's back so we know which areas to adjust. And so we're going to lay on your side facing me, please. Kathy has been coming here so long, she's almost a pro at getting in the perfect setup. Bottom hip towards me. Right here. Big breath in. Easy exhale. Let that sink right here. Good job. Other side, please. A little bit more extension in this area. Big breath. Easy exhale. Just sink right there. Good job. On your back, please.
Okay.
We're going to focus now on your pelvis, hips, and a little bit long axis distraction. So lift that leg. Nice and relaxed. Good job. Same thing here. Nice and relaxed. Good job. That's really good. Alright, I'm going to bring you up. Thank you, Kathy, for stopping in.
Alright.
It's always been a pleasure seeing you.
Yeah, thank you. I feel great.
Beautiful.
Always better after our treatment here.
I love it. If you guys have any questions, comment in the post, and we'll see you next time.